Hello South Africa, John Steenhuisen, leader of the Democratic Alliance here, and welcome to CoronaCast, our first broadcast of our dedicated coronavirus information channel. It'll be hosted by myself on a twice-weekly basis on a Tuesday and on a Friday at 2 p.m. And it will be broadcast live on the DA's Twitter and Facebook pages. We ask that you let people know about this coronavirus channel and that you share the broadcast with them. They will remain up on our Facebook and Twitter feeds for you to be able to go back to and refer to any information that you may need at a later stage. The outbreak of the COVID-19 virus has plunged South Africa and the world into a crisis. This is probably the largest crisis that we've faced in our post-democratic history in South Africa. But if we do stand together and unite as a nation, I have no doubt that we're going to be able to emerge from this, to prevent further outbreaks and to keep people safe. As a leader of the DA, I've pledged our full support to President Ramaphosa and his cabinet team as they set about on efforts by government to combat the spread of the virus, as well as the impacts on our society, our people, and on the economy of the country. We have put forward a number of ideas at the meeting last week with the President, and it's very heartwarming to see that a number of these ideas have actually been taken on board by government. And we hope that this contribution and this collaboration will continue going forward. It's time now in South Africa to get the very best heads around the table if we're going to combat the virus and we're going to ensure that we emerge from this stronger and more united as a nation. And so CoronaCast is an extension of our commitment to sharing information with people and ensuring that there's accurate information being disseminated around the virus as well as its effects. This is very important because in the age of social media, it's very, very easy for inaccurate information or fake news to whip around the internet and get people very, very worried. This is not a time for panic. Panic is the enemy in this instance. We need to be calm but deliberative in our actions, and that's going to mean that all of us check and verify information before we press share on social media. What we don't want to do is to get our citizens panicked going forward. So over the coming weeks, I will be inviting some industry experts to join me. I'll be having some members of my shadow cabinet responsible for a variety of the various cabinet portfolios to come and talk a little bit about what they are proposing and how we can work together to beat the virus, and on how we can all work together as citizens to combat the spread of the virus. So the DA's launched this CoronaCast for a variety of reasons. The three main ones are to clarify any of the rules and regulations that are going to emerge. As we know, yesterday from the announcement made by the President, we are going on Thursday night at midnight into a lockdown. This would mean that from midnight on Thursday, all citizens will be required to remain indoors, and the government will be publishing regulations to limit the movement of people during this period. This is obviously necessary. We're not going to break the spread or cycle of this virus unless we do this. It is the right action at the right time. And yes, while it may be inconvenient, it may feel like a massive intrusion in our lives, it is absolutely essential if we're going to save the lives of our fellow citizens, but also to stop the spread of the virus. We also want to communicate to you what we're doing as a party where we are in government, in places and municipalities around the country and in the province of the Western Cape and the metropolitan areas of Tshwane and Cape Town. And we want to provide a dedicated public hotline where you will be able to submit any queries that you may have or any requests for information, and we are going to make a commitment to try and get back to you as quickly as possible with a factual response so that you have a source book of factual information. And so if you have any queries, please send them through to our dedicated coronavirus address. And I'm going to share it with you today. It is coronavirus, one word, at da.org.za. That's coronavirus at da.org.za. We will also be publishing the various measures that we've put in place and the suggestions that we've made to government, as well as some handy hints and tips about what you can do as a citizen to beat the virus on a dedicated web page. And that address is www.da.org.za/defeating coronavirus. So it's a DA website with a slash, one word, defeating coronavirus. Now, before I provide you with the most up-to-date statistics, I do want to flag a concern that we have, and that is that the flow of information coming from the government department in this has not been consistent, and we're very concerned that in some provinces the testing is not being carried out at nearly the level it needs to be carried out. We've already said the WHO has recommended, if you want to beat the virus, test, test, test. We need to make sure we're rolling out these test kits in far more provinces. And so as we stand today, South Africa has 554 confirmed cases of the coronavirus in South Africa. That is 152 cases up from yesterday, which shows that the current measures are not working to flatten the curve, and it makes it even more imperative that we follow the directives that have been set out with the President's call for a 21-day lockdown. During this period of the lockdown, I want to make an appeal to you as South Africans on a number of fronts. First of all, please do not panic buy. Rushing shops and supermarkets to try and stock up on food items is going to sow a level of panic in the country, the likes of which we are yet to see. It is not what we want to do. Remember, I've said, in this crisis and beating it, we have to be calm but deliberative. Panic buying is not calm, and neither is it deliberative. Government is committed to keeping food supplies open and to keeping the food chain moving. There will be more than enough food and supplies for South Africans who need it. There is no need to stockpile. Importantly, please continue to practice good hygiene. We've already seen that washing your hands regularly with soap and water for at least 20 seconds is an effective way to combat the spread of the virus. Avoid touching your face and avoid touching other people, and make sure that you sanitize your hands before or after leaving your homes. And then, of course, during the 21-day period, which starts Thursday midnight, is to stay indoors. We can only beat the virus if every South African joins hands with the government, with these regulations, and stays indoors. Remember, South Africa, we're only as strong as the weakest link. And we're going to require every South African to show a strength that has not been called on, certainly in the last 26 years, if we're going to combat this. So please, no parties, no weddings, no braais, no drinks evenings, and no partying at your home during this time. Make sure that you keep your house as secure as possible. And we need to make sure that we take the lockdown seriously. This is our last best hope to beat the virus. If this does not work, we're going to find ourselves in a situation where the curve gets completely out of control, where our health services are completely overwhelmed, and where we then start hitting a real crisis. Please take these 21 days very, very seriously. We'll get through these 21 days. And when we emerge at the end of it, if we've all played our part, we're going to emerge stronger as a nation, healthier as a nation, and giving our economy the best chance possible of a recovery during this period. Last week, I met with the President at Steenhuisen in Cape Town to share with him some of the DA proposals. And as I said earlier in the show, we're really grateful that a number of these have been taken on board by the President. So, for instance, our Finance Shadow Minister, Jordan Hill-Lewis, recommended that South Africa's banks give a loan holiday to small businesses. Why is this important? Well, it's important because we need to keep the wheels of the economy moving even during this tough time. While we may be able to beat the health crisis, if we don't keep our economy alive and moving during this period, and at least keep the business doors open, particularly of small businesses, and to make sure they keep people on their payroll, the economic devastation that this virus will wreak will last far longer and be far deeper than any of the health implications. And so we welcome the fact that both Standard Bank and Nedbank have followed through with the suggestion. And Standard Bank has actually taken the lead by offering a 3-month payment holiday for small businesses to enable them to weather this difficult time. President Ramaphosa has also announced yesterday evening that the commercial banks have been exempted from certain provisions of the Competition Act. This will allow them to ensure that they can put in place the necessary debt relief measures. We also called for a pause in VAT, in UIF, and the Workmen's Compensation Fund payments, as well as for outstanding VAT returns to be paid to business as quickly as possible. We want to keep as much money and flow going into these businesses so that the lifeblood can continue to flow through them. Our Shadow Minister of Trade and Industry, Dean McPherson, called for a 4-month rental forbearance for small businesses. Very grateful to hear that Minister Ibrahim Patel is working hard on regulations that will guide the negotiations between small businesses and their real estate owners on how to manage this particular period and how we can ensure that they renegotiate a temporary reprieve, particularly for small businesses. Our Shadow Minister on Public Enterprises, Alf Lees, has called for SAA's 16.4 billion rand bailout to be cancelled immediately and for the budget to be reallocated to disaster management reliefs to fight this virus. Keeping planes in the air that are not going to be able to fly or carry passengers is a folly. We need to make sure that SAA is grounded and that money, those billions of rands that have been earmarked for bailout, actually go to supporting viable small businesses and taking the fight to COVID-19 in the streets, in the villages and in the towns across South Africa. And we're very glad to see a collaboration with the private sector. And I want to pause here for a little bit to send a very big thank you to the Rupert family as well as the Oppenheimer family for the exceptionally generous donation of R1 billion each to the new fund that's been created to help fight the COVID virus. This is a remarkable act of generosity in the true South African spirit of Ubuntu and giving and sharing. And we thank them for this contribution. There's no greater patriotic act than coming to the aid of your country when it is at its moment of greatest crisis. And we're very glad that Minister Blade Nzimande has heeded the calls by our Shadow Minister of Higher Education, Bax Nodada, in his efforts to ensure that universities are shut down to slow the spread of the virus. And lastly, we are engaging with our DA governments in municipalities and wherever they may be in the country to look at what measures can be implemented from a local government level to ensure that we can give some relief to small businesses and ratepayers over this period. Where we are in government, we've made the following actions. The Western Cape government, we've opened up a JOC, which has created 7 work streams focusing on health, education, social, transport and logistics, safety and security, business, and the economy and tourism. Cabinet has approved the request at a national level. The Cabinet has approved the request for the establishment of a provincial hotline to assist with Western Cape cases of coronavirus. And that number for those who live in the Western Cape is 021 928 4102. The Minister of Health has also met with private hospital groups and was going to be working very much in a collaborative way with private hospitals to see what we can do to ensure that we can keep them moving. In the city of Cape Town, beaches, as you know, have been closed. So those planning to go to the beach, please know Cape Town beaches have been closed. I'm now going to turn to some of the questions that you're sharing on this live broadcast and try to answer some of the questions that came in earlier during the week on coronavirus at da.org.za, as well as some of the live questions that you are sending through at this particular time. So we start here with Camilla Twig from Cape Town. Camilla Twig asks us, can we take our dogs for a daily walk from Friday onwards? Well, the answer is simply this. We don't know yet whether that is going to be possible, although it does seem likely that that won't be the case. A lockdown is a lockdown, but obviously what we're going to wait for is the government regulations that will be published either later today or tomorrow, which will flesh out what people will be able to do and what they won't be able to do, and what services are going to be regarded as essential services, and how we can ensure that those services continue to happen. I've got one from Derek Stain here in Kempton Park. He says here, since the pandemic has resulted in a lockdown, how will small self-employed businesses survive economically? Most of us operate our business from home, often in rented accommodation, and have to pay rent, electricity, wages, and other living costs. Understanding this, Derek, is a very, very important question that you've raised, because, as I've said earlier, it is absolutely essential for people to be able to continue their businesses and make sure they're keeping people operational and open during this time. So we're looking at the Debt Relief Fund, and the details of that are also going to be shared a little bit later, and how you'll be able to access funding to assist with that. I've already said local governments should be looking at ways in which they could provide some temporary relief on rates, on services over this period to ensure that particularly small businesses like yours, Derek, are able to survive and weather the COVID-19 storm and emerge from them still as a viable alternative. The worst case scenario is, Derek, for businesses to close during this period, because if businesses shut down, they let the employees go, the likelihood of them actually opening up again at the end of this is going to be extremely unlikely. So Lynette Spoor shares here with us that the mayor of each town should have a WhatsApp group providing info to towns. People are running around for chronic meds. Tour buses still passing through small towns, contaminating shops. The shops should limit the amount of shoppers entering. I couldn't agree with you more, Lynette, and that's a very good suggestion. There should be no tour groups moving through South Africa, and certainly during the 21-day lockdown period, the movement of individuals, particularly tourists, are going to be severely restricted. There's no use us enforcing the shutdown and then people just ignore it and carry on with life as usual. It's not business as usual, and South Africa needs to understand that. They need to understand that this virus isn't something that's happening far, far away. It isn't something that's going to only affect South Africa down the line. The virus is here in South Africa at the moment. We're on a steep curve of infections, and we require immediate, drastic action to stop it. So these sorts of things that you make here are very, very important. And I will certainly, where there are DA mayors around the country, will be sharing this suggestion for them to create some form of municipal information sharing system to ensure that people are kept up to date. Stephanie asks, what about those working in short-term insurance call centers? Well, they will also be affected. People will have to stay home. And call centers, particularly where people are put into very, very confined spaces with large amounts of people, are precisely the types of situations which we need to avoid if we're going to stop in its tracks the spread of this virus. Remembering as well that for people in certain age groups, the effect of the virus won't be anything stronger than a mild case of flu and flu-like symptoms. But understanding that you walking around in an environment with lots of other people, you could infect somebody with a compromised immune system. Compromised immune system either from the effects of HIV or TB, or even cases where there's malnutrition, where people aren't getting their daily nutritional needs. And there are a lot of people who suffer from this in South Africa. So while you may feel fine, you could be infecting somebody and then creating a life-changing situation, a matter of life or death for that individual. So you're not being asked to stay home just for your own health. You're also being asked to stay home to ensure the health and well-being of your fellow citizens. The SMME website is not working. Thanks, Kelly Vermark, for sharing that with us. I will ask our Shadow Ministers, Zach Mbele and Dean McPherson, to follow up why that website is not working. I can imagine that in the huge amount of concern during post its release, it probably has a great deal of traffic on it at the moment. But obviously what government needs to do is look at ways to streamline the process and make it quick as possible. And that's another thing. It's great having these funds, and it is important, and we're very grateful for the generous contributions to them, and we call upon corporate citizens in South Africa who can afford it to support the fund, to make donations so that we can combat this virus. But it is very important that those funds are disbursed as quickly as possible and efficiently as possible, and with the most amount of transparency. What we can't have during this period is big funds like this being abused through corruption or maladministration, as we've seen happen so many times in the past. And that's why it's very heartening to see the people that have been put in charge of the fund includes people from the private sector to ensure there is that transparency. But it's going to come down to the efficiency of getting that money into the hands of small business as quickly and efficiently as possible. Many of these small businesses don't survive. They survive month by month, and they're not going to survive a 2 or 3 month wait for the financial assistance. So we'll be pushing really hard to make sure that where the deserving cases are demonstrated, that those funds are dispersed as quickly as possible to help people like you keep your businesses moving. Someone's asked you about home loans, and that's really something that the banks are going to have to come to the party with. There's no reason why you can't extend the payment terms of the bond, add an extra 4 months to the term period at the end of it to give people some relief in the time, bearing in mind that people who are commission earners, people who are wage earners, people who rely on being able to interact with customers, and that's the source of their business, are going to be very, very badly affected. I think it would be the responsible thing for banks to show their commitment and their drive to help South Africa by considering very, very carefully small business loan repayments, credit card debt payments, as well as home loan repayments. Home loans, for most South Africans, signify the biggest chunk of their expenditure on a monthly basis. And I think this would be a very, very good way for the banks to demonstrate their commitment to getting us through this together by giving some form of relief of home loans, particularly to ordinary South Africans. Michelle Muller asks a very good point here, and she says, what can we do about getting chronic meds to 60 over? Remember, South Africa, the people most at risk are those with compromised immune systems for a variety of reasons that I've already elaborated on, but also our senior citizens. They are the category most at risk. And if you look at the death rate in many of the other countries, it has mainly been in the elderly age group. And that's very important that we keep them isolated and away from people who could potentially infect them. So we will be asking Siviwe Gwarube, our Shadow Minister of Health, to look at how chronic medication could be paid over to elderly patients to prevent them having to leave their homes to go and access this. One of the ways that we could be doing this is by ensuring bulk deliveries by the health department of chronic medications to be dispensed directly to the retirement homes or the homes where these individuals may be operating and living, to ensure that they don't have to leave their homes to access their medicine requirements. Excuse me. And we could ensure that, they've got a proper supply of their medicine. Charlene Kutsia asked here, can't schools and daycares reduce their rates? They can work out the food saving per month and the water and electricity accounts, then the people it holds can use it towards their higher bills. Well, the truth of the matter is, Charlene, it's very unlikely that the schools are going to go back anytime soon. And whilst we're in the Easter holiday period, I suspect that we're going to see the containment of large groups of people, particularly school-going children, being contained for a while longer. So I'm sorry, it may be bad news for some parents. As the father of a 3-year-old, I know the challenges of having a little one tearing around the house while you're trying to run your operation or your business from your laptop. But it's unlikely the schools are going to open anytime soon. And obviously they're going to have to look at ways in which they can provide relief for parents who are going to be really under a very, very strong financial strain over the next few months. Deepika Singh asks, hi, I have a new job in the Gauteng to start on April the 1st. I'm currently in Durban. That's my hometown, so hello to you. And you ask whether the organization can take legal action against you. I don't think an organization can take legal action against anybody when there are government gazetted regulations in place that enforce a lockdown and a travel restriction. So I really think you're on good grounds here. But I will also double check with Michael Bagram, who is a member of our shadow cabinet on the Labour portfolio, but also one of South Africa's foremost Labour lawyers, to come back and give us some advice on what this means. And maybe what we need to do is to get Michael onto the show as one of the guests to talk up through what are the implications around retrenchments, working from home, what companies can and can't do, and to make sure that you as the viewers are empowered with the correct information to prevent yourself being unfairly treated by employers who obviously are very, very concerned about what's going to happen here. Michelle De Santos asks here about shared custody and whether children will still be able to go between parents' houses during lockdown or stay with one parent only. I think it's going to be very, very difficult to have people moving around to different households. Part of the point of the lockdown is to ensure that people don't move and you limit the ability for the virus to be transacted. And so I think that parents who are not living together need to have some form of negotiation during this 21-day period about how they're going to manage it. My recommendation would be to keep the children in one place to ensure that they don't become virus spreaders, and they don't, if there is an outbreak of the virus in one home, don't take it into another home. But obviously that's something that's got to be worked out, and these things are all matters of legal agreement, and so I imagine that parents are going to have to understand that. Louis Groenewald asks here, people who have gone on holiday since schools have been closed need to be told. Yes, they absolutely do need to be told. And if they can get home between now and Thursday midnight, every South African should try to do that. The alternative is that you're going to, if you're not able to do it, you're going to have to stay wherever you are during the lockdown. But I certainly would advise any South African that's currently at a holiday resort or away from home and is unlikely to be able to extend that stay, to start making their way back home as quickly as possible to try and avoid falling foul of the 21-day lockdown period. So Lisa Schneider asks about ventilators, and that is a very, very important point. And as you know, one of the big crises here is that if we don't flatten the curve, it forces a run on the health facilities who have limited capacity. Our health sector, particularly our public health sector, was already under enormous strain as a result of mismanagement over the last 2 decades. And there's shortages of equipment in many of those hospitals. But what is now required, I believe, is for the public sector and the private sector to work together to demonstrate that the future of South African healthcare actually lies in a partnership between private healthcare and the public sector. And so I've been encouraged, certainly from what I've been hearing, amongst the private hospital groups who in each province are starting to open up beds to government to be able to say, we will be able to accommodate these people. But bear in mind, there is a finite number of ventilators. Ventilators, too, are quite specialized equipment. They generally require to be applied by an anaesthetist or certainly a qualified healthcare professional. And so it is important to understand that there is a shortage of those around the country as well. And that is why the focus has to be on preventing the infection, preventing the rush on hospitals, so that those cases where we're not be able to prevent, or those people who already have it, are able to get the assistance. The big crisis will come when, if we're not able to flatten the curve, there's a huge move of people into hospitals, and hospitals then run out of space, run out of ventilators, and run out of personnel to be able to deal with the crisis. That is what we're trying to avoid, and that is why this lockdown of 21 days announced by the President is so essential, and why we as South Africans need to play our part in ensuring it. Daniel Lawrence here says that I think that relief in rent should follow relief in bond payment, and I couldn't agree more. I think that landlords particularly need to understand that this is a very, very difficult phase for many people who are renting properties. And I think that as tenants, there should be an opportunity to approach the landlord to look at some interim relief over this period. even if the landlord was to extend the rental period by the months that he would be offering the relief in order to recoup that. But I do think that there needs to be some forbearance by people, particularly on the costs. It's also in landlords' interests, because if you suddenly have a huge lot of rental property suddenly being flooded onto the market, post the virus, it's going to be very, very difficult to get and obtain a market-related rental to what people are receiving at the moment. So a bit of short-term pain for a landlord might actually result in long-term gain in ensuring that the value of your rental property, as well as the value of your property, is retained and doesn't collapse from an oversupply of rental stock on the market because people are being forced to move out as a result of rental payments. So I agree there. JP Verster asked, what is happening with public transport? Public transport is one of the huge gateways of the virus into our communities. In South Africa, we still have large amounts of people who rely every day on public transport to get to and from work. And part of the thinking behind the shutdown is to make sure that if people aren't having to go to work, that they don't have to get onto public transport systems, which are a virus's heaven to be able to transmit and spread. And so public transport will come to an end. In the city of Cape Town, over the course of the last 2 weeks, the number of passengers on the MyCity system have been limited to 20. But obviously during the period of the shutdown, public transport will have to come to an end. And if there is public transport that's allowed, there will no doubt be very, very strict regulation about how it can operate, the number of passengers that can be on, and very, very strong disinfectant regimes are going to have to be followed. But where possible, people should avoid public transport and should avoid places where large people congregate and where the virus can be spread very, very easily. Gerrit Swart asks, if you've had COVID-19 and have been cleared from the virus, what's the chances of getting infected again? Well, that's also one of the reasons why it is essential to flatten the curve and prevent the spread of the virus, because what we've seen was an inbuilt resistance in, and particularly younger people, as I've said earlier, will probably get a flu-like symptom and will feel grotty for a few days, but it won't manifest itself in any major life-threatening way. It becomes life-threatening in young people and very, very old people. And that is why we have to make sure that we contain the spread, because the more the virus spreads between South Africans, the more chance there is for it to mutate. And then trying to get a vaccine eventually to beat it is going to make it's going to make it very, very difficult to do so. And so that is one of the reasons why to break the chain of infection is such an essential step for us to be taking. As I say, while it may seem drastic to some, and while it is massively inconvenient to life, to society, and to the economy, it is so absolutely essential that we break the chain of transmission between South Africans. The lockdown within the SAPS, Tanya Hodgson asks, does this include admin staff? Well, I imagine that the SAPS, as the primary law enforcement agency in South Africa, is going to be required to remain in full operational mode. And I imagine that admin staff will be required to give support to those officers who are out on the ground enforcing the regulations, making sure that people are abiding by the regulations, and ensuring that the irresponsible members within our communities who simply choose to disregard the seriousness of this crisis are dealt with effectively, and so that they don't continue to pose a significant risk to law-abiding citizens who are doing their part in beating the virus. So I imagine that there will be admin assistance still required to the SAPS, and I imagine that the SAPS itself will have to have protocols in place around keeping distance from people within the workplace, disinfecting workplaces continuously, and putting in place measures to prevent the transmission of the virus. But it is essential that those personnel there. And I want to stop here for a little bit, and I want to pay particular tribute to the frontline responders in South Africa across the board. Our policemen and women, our men and women in the SANDF in uniform, as well as every healthcare worker in both the public and private sector, for the brave work that you are doing on the front lines of beating this virus. We are a grateful nation for your service, and I want to take this opportunity to pay tribute to you. And I want to challenge you, South Africans, that in the next few days before the lockdown, if you do come into contact with any one of these people, that you just say thank you. You say thank you for the work that they're doing, putting their lives at risk to ensure that we can survive and stay safe as South Africans. So to all the first responders out there, all the medical personnel, thank you. Thank you for the work that you're doing. It is gratefully, gratefully appreciated, and we are a nation in your debt. Franz Smith asks here, would the life insurance companies also be able to extend an olive branch? Brokers will go bankrupt when clients start cancelling their life insurances, never to recover. Well, I think in the time of a crisis like this, the worst thing you can do is to cancel your life cover. I think it's essential to make sure that you and your family are protected going forward, particularly in the case of uncertainty around the spread of a virus. So I certainly hope people won't be out there cancelling life insurance policies and policies that are designed to keep their families' income safe if they were to pass away. I think this is the time when your life insurance is actually needed the most. Hardware businesses, Esther Spang asks, hardware business, must they also be closed for the shutdown? Well, Esther, we're going to see the regulations later today, or say first thing tomorrow, around which business are being listed as essential services. The President's already given us indication that it will be police, medical personnel, and we're hoping that private security will be included in that, because like the private healthcare sector, the private security industry are very important for maintaining order, and I think they could form a very good partnership with the SANDF and the SAPS to ensure that we have a more comprehensive response and more boots on the ground to ensure the enforcement of the regulations. I'm not sure if hardware stores are going to be included in this essential service, certainly during the 21-day period. I know that my wife's got a long list of DIY projects that she has in her mind for me to complete over these 21 days that we're at home. So I'd make sure that you stock up on any of those requirements from a hardware store before the 21-day lockdown starts, so we can you can keep keep the wives at home happy that the DIY work is continuing to flow. Abby Sonosi asks here, what happens to parents who've had to stay at home because their children's schools have been closed and have been let go because of this? Is this a fair labour practice? It is an excellent question. I don't have the answer now. My initial thought is no, it's not fair given where the crisis is. But as I say, I'm going to invite Michael Bagram to come onto the show, and we're going to have an afternoon dedicated specifically to all the labour law queries relating to what workers can expect, what they can expect from employers, and what employers can expect from their workers as well. But I would like to make an appeal to the employers out there particularly. If it is possible for you to keep your employees at home, to keep them working remotely and to adjusting your company, it will only serve to build resilience for your company going forward. And I think that's a good thing. We already in the DA have had to get used to a completely new way of doing things. I've been convening regular shadow cabinet meetings via a platform called Zoom. We were able to get everybody onto a video teleconference. It's going to require adaptability, but through adaptability, I think we can build far more resilience as a nation to be able to face any disasters that come our way further down the line. JP Faster asks a very good question. If lockdown fails, what is the next step? Well, I think that we've seen what that next step is, and it's something we have to avoid at all costs. We've seen what happened in Italy with the very steep climb. And as I said, what we want to avoid is the critical growth, exponential growth of the virus. We've already seen how it's grown by 152 cases since yesterday. That, if you look at virology, and the experts will tell you, if you model that, we're far steeper in the curve than other countries were at a similar stage. And so it is right that we're doing the lockdown now. But if the lockdown doesn't work, I think, JP, we're going to face massive infection rates around the country. We're going to see a massive overburdening of the health system, leading potentially to a collapse of healthcare services. And we're going to see South Africans dying. And that is why it is absolutely essential that we make these 21 days really count, and that we get behind it with a 100% commitment as South Africans, understanding that we are sometimes called upon to make sacrifices for the better functioning of our country. And this is one such example. Zelda Kamp asks here, I work for a food manufacturing company. Do we need some kind of permit to continue manufacturing and staff traveling to work? That'll be set out very, very clearly in the government regulations. But the President has been very, very clear that particularly with the food chain and food security, it is absolutely essential to keep those products moving. So I imagine there will be a dispensation for that food manufacturing company to continue to work and to keep the products flowing into the supermarkets so we don't have empty shelves and we don't trigger panic buying going forward. So I think that's very important that that flow of the food chain continues as unimpeded and uninterrupted as possible. And so I imagine, Zelda, that that will be the case with your manufacturing business. But obviously, the measures that are put in place by those workplaces are going to have to be very, very stringent to protect against an infection amongst the employees in that workplace. Cornelia van der Merwe asks here, are pregnant ladies allowed to go to gynecologists for their checkup? The President's been very clear that you can leave the house to seek medical assistance, to do food shopping, and to go to pharmacies to obtain medicine, essential travel. And so I've absolutely no doubt that gynecologists are very much part of medical professionals, particularly female citizens who have complications with their pregnancies. Will obviously have to keep there, but obviously very important and stringent measures are going to have to be taken place, that you're going to have to leave your home, go straight to the gynecologist's appointment, make sure that the protocols are followed, the hand washing is followed, the sanitization is followed, and then to go directly home afterwards to prevent any chance of contacting any other individuals. I imagine that healthcare professionals will stagger their diaries and their appointments to make sure that you don't have a situation where there are a lot of people sitting in a waiting room waiting to see a doctor, that you will essentially come in for your appointment and leave straight afterwards, and the next patient would be allowed in. Aubrey Kopp, I think I've answered the question here already. The regulations will determine how you'd be able to do it, but you will be able to go out and get food and be able to go out. And I would encourage you to keep an eye on the website. As I said earlier, we've got the DA's website that's been set up for CoronaCast, and you can keep an eye. We'll be updating as soon as we know more information about the regulations and what they mean for South Africans and how we can unpack them. Reminder of the website, www.da.org.za/defeating coronavirus. That's one word, defeating coronavirus. Keep an eye on that website, Aubrey, and it will be able to unpack far more explicitly what the impacts of those regulations are. Mari Bielefeld asks, which businesses can be open? Well, of course, the businesses that are declared essential services, Mari, will be the ones that are able to remain open. And they will obviously be very, very restricted to essential services that our citizens would need over this period to keep open. Yes, and I want to deal with this, Chris Griff. Thank you very much for raising it. There was an absolute panic and pandemonium that broke out this morning on social media with some screenshots about which businesses are going to be helped during this crisis. And there was the slide that showed that only businesses with a 51% BEE component will be provided with assistance by the government. Our Shadow Minister in Trade and Industry, Dean McPherson, our Shadow Minister of Small Business, Zach Mbele, and myself have reached out to government to get clarity on this. And we have absolute commitment that this is not a requirement for you to be able to receive assistance. The assistance will be available to all qualifying small businesses in South Africa. And so I'm really making an appeal again. Before you share something on social media, given how febrile the mood and how on edge South Africans are at the moment, and how much time people are going to be spending on social media, please verify very, very carefully before you simply share information. Make sure, is it from an official site? Is it something that you've been able to verify as true before simply sharing it? A reminder, the lockdown time, Thursday, 12 p.m. The lockdown time will be on Thursday at 12 p.m. Although that will be the time the official lockdown starts, it doesn't mean that there's carte blanche for everyone to just carry on their lives as normal between now and then. Why that deadline was given was to give South Africans time to get home, time to be able to stock up their fridges, etc. But it doesn't mean that life must go on as normal today and tomorrow. If you can stay at home, please stay at home. The fewer citizens we have on the street, the better it's going to be, the more effective the lockdown period is going to be. Please don't wait for that deadline to start to take the measures that are required. We're heading up for a wrap now on this very first Corona cast. Remind you again, if you've got any queries that you want us to answer, coronavirus@da.org.za. I look forward to these interactions with you, South Africa, over the course of the next few weeks, and particularly during the lockdown, and invite you to tune in again on Friday at 2 p.m, where we'll unpack even further some of the regulations that have been published and what these mean for you as South Africans, but also how we can keep each other safe. Remember, sanitize your hands, hygiene, focus on that. Make sure your hand sanitizers with you at all times. Make sure you're isolating elderly people and preventing them from contact with people, and make sure that you're doing your part in combating COVID-19. We can do this, South Africa, but we can only do it together. Keep safe out there. It's been great to be with you. I look forward to our next engagement.